Okay, so let's discuss chapter number 16 now, and let me go to the show mode. Um, so in chapter number 16, we are going to talk about the diseases, the infectious diseases which affect the skin and our eyes. Okay, so we're going to talk about various microorganisms which cause these diseases. Okay, just give me 1 second. So I think some of the diseases you may be already knowing, but what I want you to do in all this, because we are going to talk about various infectious diseases. So I basically want, because you guys are you're going to be healthcare professionals. So I think the most important thing for you guys to need to know is what is a causative agent and what are the symptoms, and also you guys need to know that disease. Okay, the very first disease which I'm going to talk about is MRSA, skin and soft tissue infection. Now, what is MRSA? So, MRSA is, I have written here, methicillin resistant Staphylococcus aureus. Okay, so methicillin is basically a derivative of penicillin. So this is the infection of the skin and the soft tissues, which is caused by the bacteria which is called Staphylococcus aureus, and it is resistant to the methicillin. Okay. Now talking about what is Staphylococcus aureus, it's a gram-positive coccus. So we have already talked about a little bit about what gram-positive and gram-negative bacteria are, and what are we have talked about the shapes. We talked about in chapter number 3 the shapes of different kinds of bacteria. We talked about what is a coccus shape, what are rods, all these things are already done. So Staphylococcus aureus is a gram-positive coccus that grows in clusters, and it is non-motile. And usually Staphylococcus aureus is a normal flora on the skin, but it can be very virulent also. It can be very pathogenic. It can cause various diseases. Okay, so, and very important thing to know about this Staphylococcus aureus is that some of the strains of Staphylococcus aureus, they are resistant to multiple antibiotics. Okay, so we are talking about the infections which are caused by methicillin resistant Staphylococcus aureus, but they are resistant to various antibiotics. Okay, they resist the effect of many disinfectants and the antibiotics, and they cause lesions, skin lesions in the non-hospitalized people. So you can see here, this is the kind of lesion which is because of this kind of bacteria. So you can see here, these are raised, red, you can see that color, tender and localized lesions, and sometimes they also get pus in them. Okay, and they feel hot to touch. And usually sometimes to treat them, this pus has to be drained out sometimes to treat them. And in these kind of infections, sometimes there is a fever also. People get fever, and usually these kind of skin infections or skin lesions they usually occur where there are breaks in the skin, and they can also localize near the hair follicles. You must have seen sometimes some lesions, skin lesions occur near the hair follicles. Okay, how to prevent that? That's very important to know. So prevention is by good hygiene, so maintain good hygiene. And as I said, sometimes this lesion has to be treated by medicine, and the pus is drained out. So to treat them, as I said, they are resistant to multiple antibiotics. So they need to be treated with multiple antibiotics, and usually vancomycin, which is a broad spectrum antibiotic, is recommended in US to treat these kind of infections. Next category I'm going to talk about is it's called maculopapular rash disease. So first of all, what are maculopapular skin eruptions? What are they? So usually these are kind of skin eruptions which are usually flat to slightly raised colored bumps. Okay, so if you look at these eruptions, they look like that. They are usually flat to slightly raised colored bumps. And these kind of eruptions can be caused by a variety of microorganisms. And under this, we are going to talk about measles. Measles is also called rubiola, rubella, and roseola. Okay, first of all, we are going to talk about measles. Measles is also called rubiola, and there's a vaccine for this. Before the vaccine for measles was introduced, measles killed around 60 million people every year, just to kill so many people. Now we have a very effective vaccine for this disease, but still around 367 children die of this disease per day. And a lot of people have some misconceptions with the measles vaccine. You must have heard about that this vaccine can also cause autism. So that's why some people don't want to take this vaccine. And you can see here, these are the symptoms of measles. Dry cough, so people have kind of flu-like symptoms, headache. It also involves conjunctivitis, which is the infection of the eye, lymphadenitis, which is the enlargement in one or more lymph nodes, fever. People can also get oral lesions, which are called Koplik spots, and people also get exanthem, which is red maculopapular rash. So this is a kind of a rash which is occurring on the outside of the body. So usually these kind of rashes erupt on the head and progress to the trunk and the extremities. So you can see all these kind of rash will get in the measles. If it gets really complicated, people can get laryngitis, bronchopneumonia, and people can also get secondary bacterial infections such as ear and the sinus infections, pneumonia, and encephalitis. If it goes very deep to the central nervous system, it can cause that much effect too. Can result in permanent brain damage or epilepsy. Yes, we are talking about measles. It can become that complicated. Yes. So the prevention of measles this is a very well-known vaccine called MMR vaccine. So M is measles, mumps, and rubella vaccine. So how does this vaccine work? So measles is caused by a virus. So this vaccine contains live attenuated measles virus. So the virus is not dead, it's live, but it is attenuated, which means it is a weakened virus that confers protection up to 20 years. And this is recommended for children, which is the children who are between the age of 12 and 15 months with a booster dose before the child enters the school. Okay, how to treat measles? This is a prevention, but now how to treat it if somebody gets it? Number one, reducing fever, suppressing cough, replacing lost fluids. So replacement of the lost fluids is very important. Okay, so these are some of the common things which can be done. Okay, next disease we are going to talk about is rubella. Okay, rubella is also called German measles. Okay, and this disease involves minor rash with few complications. Okay, but this disease can cause serious damage to the fetus. Okay, so the women who are in the childbearing age, they must be vaccinated. And postnatal rubella, if somebody gets after postnatal after the fetal stage. So what are the symptoms? You can see here, rash of pink macules and papules. You can see this girl has got rash which is of like a pink color, and this is less severe than the measles. You can see that. So these rashes appear first on the face and then progresses to down the trunk and towards the extremities. Yeah, and usually it resolves in 3 days. And as I said already, the rash is milder than the measles rash. And it can also involve joint inflammation and pain rather than rash. So that is in adults. So adult rubella is characterized by joint inflammation and pain rather than rash. So usually rash is in children. The causative agent of rubella is rubivirus, from the family Togaviridae, rubivirus. So what is its prevention and treatment? It's the same vaccine, MMR vaccine, because R is for rubella. So this vaccine prevents from measles, mumps, and rubella. So it's the same thing which is for measles. It's given at so it's the same vaccine basically. It's given at 12 to 15 months with a booster dose at around 4 to 6 years when the child is ready to go to the school. Okay, next we are going to talk a bit about is called roseola. So this is a disease which is common in young children and the babies. Okay, so in this disease, this disease can also cause a macular rash like this. You can see here the same kind of rash. But 70% of the patients, the children, because it's a disease of children and the babies, they proceed without a rash stage. Okay, so usually they get very high fever, and that fever lasts for up to 3 days. And on the 4th day, basically, the fever will be gone and the rash will appear. And first of all, the rash is on the chest and the trunk area, and then less prominently on the face and the limbs. So you can see this is a kind of a rash which is in this disease. Okay, what is the causative agent of roseola? It's a human herpes virus 6, HHV6, human herpes virus 6. So that's the virus which causes this disease, the skin disease. So there is no vaccine and there is no treatment for this. So it, I think, just resolves on its own. Okay, the next disease we are going to talk about is called impetigo. So in this disease, basically what happens is it is caused by a bacteria, and it can be caused by the bacteria Staphylococcus aureus and Streptococcus pyogenes. So we just discussed about Staphylococcus aureus. They are gram-positive coccus, and they are present in irregular clusters. And there is another cocci called Streptococcus pyogenes. These coccus, they are present in chains. Okay, so Staph aureus in irregular clusters and Streptococcus in the chains. They are also coccus. So this disease called impetigo is a bacterial infection, and it is caused by these two bacteria. And what happens in this disease is, you can see here, the skin becomes very flaky, or the skin starts peeling off. Okay, you can see here how the skin is becoming flaky and it is peeling off. So what are the signs and symptoms? So the skin lesions, there's a peeling of skin, crusty and flaky scabs, and the lesions mostly found near mouth, face, and the extremities. Next is cellulitis. This is caused by cellulitis is basically the infection in the dermis and in the subcutaneous tissues, and it involves pain, tenderness, swelling, and warmth. And also there is swelling of the lymph nodes in this disease. And in this disease, bacteremia can also develop, which means the bacteremia is a condition when there is a growth of the bacteria in the blood. Okay, so cellulitis is a skin disease, but it can also lead to bacteremia. Okay, and it can also lead to the fever and the swelling of the lymph nodes. And this is basically an infection in the dermis and in the subcutaneous tissue. So cellulitis is a basically infection of skin, and this infection is there in the dermis layer and in the subcutaneous tissues, but it can go to the blood, and it can also cause the swelling of the lymph nodes. The complications is basically caused by bacteria. In the healthy individuals, the cellulitis can cause Streptococcus pyogenes, and if some individual is immunocompromised, means its immune system has is not working properly. It can happen in various kind of conditions. Immunocompromised individuals, if somebody's immune system is compromised, that individual is called immunocompromised individual. In those kind of patients, all this condition called cellulitis. And in infants, group B, streptococci can cause cellulitis. Okay, so what is the prevention and treatment? It responds well to the antibiotics, to the oral antibiotics. So people can be given oral antibiotics. There's no need of giving intravenous antibiotics. Just oral antibiotics are fine for the mild cellulitis. So the antibiotics which work against Staph aureus and the Streptococcus pyogenes. In the case of patients who have who are immunocompromised, which means their immune system is immunocompromised, and in those kind of patients, cellulitis is going to be more complicated. In this kind of patients, they need to be given intravenous antibiotics. Okay, the next disease we are going to talk about is Staphylococcus scalded skin syndrome. We also call it staphylococcal scalded skin syndrome. This is a dermolytic condition, which means there is a breaking of the skin in this situation. It's caused by Staphylococcus aureus. It affects newborns and babies, but it can also infect children and the adults. So let's see its signs and symptoms. Usually these people, these infants, they get bullous lesions which appear, you can see here what kind of lesions they have, appear first around the umbilical area in the neonates or in the diaper of the young children. Okay, so what happens in this disease is there's a split in the epidermal tissue layer. This is all epidermis, you can see. Okay, so epidermis is all one single layer, it's all intact in normal people, but in these patients, when they get infected with this bacteria Staph aureus, you can see there's a split in the epidermal layer, and it can cause the desquamation of the skin follows. And causative agent is Staph aureus. Okay, so in this case, again, in the neonates, they should be they should be avoided the contact with somebody who is actually carrying Staph aureus and giving it to them. So eliminate carriers in contact with neonates. If somebody is carrying this bacteria, they should be not coming in contact with the neonates. And the treatment can also be given with the systemic antibiotics. Next, we are going to talk about the diseases, these skin diseases which involve the formation of skin lesions, and those skin lesions are not dry, but they contain fluid in them. So they are called vesicular or pustular rash diseases. Okay, and in this we are going to talk about chickenpox and we are going to talk smallpox. Okay, both of them are viral diseases. They're caused by viruses. So first of all, let's talk about chickenpox. So basically, this disease involves fever and the formation of the rash, but this virus has a long incubation time period. So it will infect the individual for 10 to 20 days and then it will show its symptoms. And the symptoms are usually fever and the rash begins on the scalp, face and trunk, and it then radiates to the extremities. So the skin lesions progress quickly from macules and papules to itchy vesicles filled with a clear fluid. So first of all, they are the macules and papules, just the way we discussed in the other diseases like your measles and all that. So they are all macular papular rashes, which means they're dry rashes and they're little raised rash. So these skin lesions, they progress through all these stages and eventually becomes like vesicles which are filled with some fluid. Okay, so in chickenpox, the lesion distribution is centripetal. What does that mean? So more lesions are seen in the center of the body than in the extremities. That is the meaning of being centripetal. They are more towards center of the body than towards the extremities. Usually the symptoms they last for 4 to 7 days. Okay, so new lesions, they stop appearing after 5 days. So these symptoms, these lesions, all the vesicles filled with fluid, they will stay on the patient for 4 to 7 days, and after that they will stop appearing, but the patient is still considered contagious until all the lesions they have all crusted over. Okay, so it's important that these people who are having chickenpox, they should not be coming in contact with somebody who is having these vesicles in that specific time period till it's all the lesions they have crusted. Okay, so till that time period, all these patients are considered contagious. Okay, it can go to brain also and can cause encephalopathy, but it's only very rare, 0.1% is the chance. Okay, smallpox is basically not totally a disease. Okay, so it's a disease of past now. So you can see what basically happens in smallpox. So people and the rash, it begins in the pharynx, spreads to the face, and progresses to the extremities. So the rash again goes through various stages: macular, papular, and it becomes vesicular and pustular, which means that you can see all these skin eruptions. They are all filled with the fluid, and it will eventually crust over. Okay, smallpox is of two forms. One is called variola major. It's a very virulent form. It's a very severe form of smallpox, and it can also called toxemia. Okay, so which means it can cause toxemia, which means the toxins can go to the blood. So in this disease, basically these are important symptoms: high fever, rash emerges first in the mouth, then people can also have, these children can also have severe abdominal and back pain, and then the rash spreads throughout the body within 24 hours. Okay, we are discussing variola major, which is a severe form of smallpox. So after third or fourth day of the rash, these bumps become larger and are filled with the thick opaque fluid. As I just discussed, these skin eruptions, these skin lesions, they go through different stages. So initially they are dry, and then they start getting filled with the fluid. So they will begin to scab after a few days. So after 2 weeks, most lesions have crusted over, but the patient remains contagious until the last scab falls off. Okay, so which means that till the people, till the children or some adult whosoever gets the smallpox, till their lesions are still crusting off, they are considered contagious. Okay, so they should not be coming in contact with other people. And during the rash, when the people have this rash, the patients are very sick at that time. So the other form of smallpox is called variola minor. The rash is less dense in this. Okay, and the patient is less ill with is less sick as compared to with the variola major. And the causative agent of smallpox is variola virus, and this belongs to the category of viruses called orthopox viruses, and these are DNA enveloped viruses, which means these viruses have the genetic material as DNA, and these viruses, they are covered by an envelope. So the vaccination is available for smallpox after somebody, vaccination is available for post-exposure prophylaxis. Okay, the next skin disease we are going to talk about is called leishmaniasis. This is, we are going to talk about leishmaniasis. We are going to talk about the cutaneous leishmaniasis. This is an infection of the capillaries of the skin, basically, and we also call it a mucocutaneous leishmaniasis, and it affects the skin and the mucous membranes. And the causative agent, you need to know the name of the organism which causes cutaneous leishmaniasis. The name of the organism is Leishmania tropica. So Leishmania tropica causes cutaneous leishmaniasis, and then the mucocutaneous leishmaniasis is caused by Leishmania brasiliensis. So there is no vaccine for leishmaniasis. Only these people the patients can avoid the contact with the sand flies. And the last skin disease we are going to talk about is called cutaneous anthrax. This is a disease caused by Bacillus anthracis, and this is cutaneous anthrax because this is infection of the skin. And in this, it's the skin lesion is very prominent. You can see this is the skin lesion in this disease. So it's a papule that becomes necrotic, okay, and later ruptures to form a painless black, it's called eschar. So it's a kind of a black, this skin lesion becomes black in color. So there's a vaccine for this, but it is only recommended for high risk persons. Okay, now we're going to talk about the infections of the eye. The very first one we are going to talk about is called conjunctivitis, which is a very common. It's an infection of the conjunctiva. It's a very common, and many people have suffered from this. It can be caused by viruses as well as bacteria. So basically, these patients who get conjunctivitis, they can be there can be some injury in the eye, or they can be due to contact lenses. Also, sometimes contact lenses are also contaminated, and because of that, the conjunctiva of the eye gets infected with these contaminants, and people get the conjunctivitis. So when people usually get infection with the bacteria, conjunctivitis is because of the bacteria. There's a production of a milky discharge, and when the infection is because of viruses, there's a production of a watery discharge. And usually we also call it as a pink eye. Usually people have seen, like, when they get infected at night they're fine, and when they get up in the morning, their eye is all glued up because of the production of all the secretions have accumulated during the night, and they solidify, and in the morning a patient will not be able to open the eye because the eye will be all glued up, it will be all shut down. It's because of all the accumulation of the secretions during the night time. So you can see here how there's a accumulation of all the secretions, and they have solidified, and this patient cannot open their eye. So some of the causative agents which can cause this kind of disease, they are called Neisseria gonorrhea or Chlamydia trachomatis. These are the causative agents. These are the bacteria which can cause this disease. And as I said, this can also be caused by virus. One of the virus which can cause conjunctivitis in the neonates is called herpes simplex. So basically right now we are talking about the conjunctivitis which can be caused in the neonates. So Neisseria gonorrhea and Chlamydia trachomatis, it can cause the conjunctivitis in the neonates, and these bacteria can also be passed vertically, which means passing from mother to the child. From the genital tract, they can be passed from the mother to the child, and they can cause this kind of a conjunctivitis in the neonates. So Neisseria gonorrhea and Chlamydia trachomatis, they are responsible for, these are the bacteria which are responsible for conjunctivitis in neonates, and herpes simplex is a virus which is responsible for neonatal conjunctivitis. The bacterial conjunctivitis in other age groups can be caused by Staphylococcus epidermidis. This is all the list of bacteria. You can see Streptococcus pyogenes, Streptococcus pneumoniae, Haemophilus influenzae, or Moraxella. So these are all the kind of the bacteria which can cause conjunctivitis in other age groups. Yeah, even fungus, some protozoa, they can also cause conjunctivitis. The viral conjunctivitis in other age groups can be caused by adenoviruses also. Okay. And usually conjunctivitis, a lot of people get conjunctivitis because of the contact lenses. The contact lenses, they are contaminated, and through that people get this infection, and these contaminants, they are transferred to the eye. Okay, the important treatment for conjunctivitis is this antibiotic called ciprofloxacin. So it can treat the neonatal cases of conjunctivitis. The neonatal, not neonatal, but the non-neonatal cases of conjunctivitis, they can be treated with ciprofloxacin. Okay, the last one we are going to talk about, which is the eye infection, is called keratitis. This is basically involves the invasion of deeper eye tissues, and it can lead to corneal destruction, and it can also lead to blindness. Okay, and the causative agents are miscellaneous bacteria can cause this keratitis, which is a deep eye tissue infection, and it can also be caused by herpes simplex virus. Okay, what is the treatment for keratitis? Trifluoridine or acyclovir can be given to these patients. And the last thing we are going to talk about keratitis is called acanthamoeba keratitis, and this is the eye infection, deep eye infection caused by amoeba. Okay, amoeba is a protozoa which we discussed in chapter number 4. Okay, it can also, amoeba can cause keratitis in people who wear contact lenses. So remember that a lot of people who wear contact lenses, they need to really take care of the eyes, because they can get all these kind of infections. So this free living amoeba, they live in tap water, fresh water lakes, and they can get into the eye, and all these amoeba, they can cause these kind of keratitis. Okay. Okay, so this is all about chapter number 16.